The overdose epidemic is a widespread public health emergency. It is causing more people to seek emergency care due to non-fatal and fatal overdoses. Per the FDA, in 2021, a record number of Americans, more than 107,000, died from drug overdoses. This affects many aspects of our lives, including losing loved ones, as well as putting a lot of strain on the society because of deaths and lost productivity. We have a series of informational interviews to discuss this complicated topic, and today we've invited an expert, Dr. Ali Nemat. Dr. Ali Nemat, thank you so much for being here with us. Could you give us a little background on the opioid epidemic in this country?
It's great to be with you, Nicole, today. The issue of the opioid epidemics, it goes back to maybe more than 2 or 3 decades ago. There was a time that there was a need for the patients. There was a deficiency in addressing patients' pain. So as we were getting more awareness of the topic, there was a movement that started back then, and then there was more advocacy for the pain patients, very rightfully. To find new ways for them to help with their pain control. This started with a wave of new generation of pain medication coming to the market, as well as some of the old ones that found more usage for them, and then they started introducing it to the U.S. market. So this was pretty much all that started it. The need of the patient population who were in pain, a high number of patients with chronic pain who needed their pain to be addressed, as well as a lot of patients who were in need of pain for different reasons, such as acute pain, patients with cancer pain, and patients who were getting surgeries and they needed like more inclusive treatments for their pain presentation.
So then when these opioids came about, did doctors know that they were addictive?
So there was a move before this generalized or more widespread use of opioids was advocated by so many different entities that the doctors or the healthcare providers were hesitant to provide these medications to the patients. But there was a new wave that came around, including making the pain as the 5th vital sign, and also making sure that, like, if the patient is in the hospital, we don't not only check their blood pressure, heart rate, and temperature, and pulse, as well as their breathing. They included the pain as the 5th vital sign. So it became more and more customary and routine that when we go to the patients, we ask about their pain. As time passed, there was more and more push towards prescribing the opioids for more patients. And that was the beginning of it.
I see. So then what factors contributed to this opioid epidemic, would you say?
I think this is a multifaceted issue. It probably would take more than the few minutes that you and I have together today to discuss that caused to this problem to be the problem that we are facing on today to come aboard and come about. I think the number of the patients that were hurting from a lot of chronic pain issues was one factor. They now were learning that the opioids are available for their use. So they were going to their doctors or healthcare providers and they were asking for medications. Doctors also realized that now they have a new weapon as part of their armamentarium to start using to treat these pain case scenarios. So I think the wave, it was like a small wave and then started and then suddenly turned into a big, huge wave that nobody could control.
Right, yeah. It's definitely gotten exponentially larger in the recent years. So What would you say happens to patients who have legitimate needs for pain relief? For example, a patient who has cancer and like truly needs their medications.
I think this is a very important aspect to discuss. Since this wave started, and then all the powers to be both on the public side as well as the governmental side realized that we are dealing with a huge wave with all the numbers of the patients who were having side effects with the opioids. Either they were getting overdoses or which could sometimes would be fatal. So everybody realized that this needs to be addressed. And so limitations were placed on the prescription and the usage of the opioid medication. But then the problem is that we have a group of patients that they have legitimate needs for their pain control. For example, the cancer patients. Cancer pain was the original reason that FDA approved a lot of these opioids and pain medications to be authorized for the patients to be using, for the prescribers to prescribe. But unfortunately, when all these limitations started, a lot of these cancer patients, it turned out that they started to have issues with getting their pain medication. Yeah. I had my own patients that I was giving them medicine. They would tell me that they go to the pharmacy. The pharmacy, some of the pharmacies stopped providing opioid pain meds, and some of them put a lot of limitations for the patients. So they were not able to find their medication. So that became a major issue, which hopefully, with everybody's understanding, and now the things are calming down, hopefully on that sector, hopefully things are better for those patients who really need their pain medication to address their uncontrolled pain.
Yeah, it's really unfortunate when you do know someone or have someone close to you who has cancer and they're just in pain and there's no way for them to get their medicine.
That's very true. Now assume that I am in my office and I prescribe my patients the appropriate medicine, and the patient goes and then they get the runaround because they are not able to get their medication. Or they get promised that, oh, this medicine would be delivered, I can order it for you, it would be delivered in several days. My patients has limitations on their supply of pain meds, so that becomes a huge challenge.
In your experience, is it fairly hard to get a prescription for opioids, or how has that been recently?
So I need to give you some perspective into this for answering this question. The issue came about, it was true that doctors and healthcare providers started prescribing more pain meds. Unfortunately, like everything good, it comes with a baggage, like everything else in life. A lot of misuse or abuse happened with all these opioids that were now available in the US market. And then we saw that how many lives were lost due to the misuse or abuse. Very strict restrictions were placed for prescription, and also prescription by the physician, and also by the pharmacist to prescribe it to the patients based on the doctor's prescription. But hopefully, as we move forward, there would be less and less of issues. So now, hopefully, the patients who have legitimate reasons for receiving the opioid pain medication, hopefully they would be able to receive their medicine. I think couple of years or few years back, I think it was more difficult, but I think the train is back on the rail again, or is coming back on the rail.
Yeah.
So we are getting to a position that patients who have real needs would be able to get their medicine and use it safely. And then all those misuses and abuses could hopefully be prevented as much as possible.
Yes, I definitely hope so. Well, thank you so much, Dr. Nemat.
My pleasure.
For this candid discussion is very enlightening. I understand this might not be an easy topic to discuss since it's affected so many in our communities, including those we have lost and their loved ones. We hope through this series we can come up with solutions that we can collectively help to resolve. I'm Nicole Sober with DrKumo. Stay tuned for more, and don't forget to like, comment, and subscribe.